Good morning, everybody. Welcome to today's free webinar from PAN Wellness called Diabetes Defence, and specifically today just to support World Diabetes Day. My name is Laura Jordan. I'm the Commercial Director at PAN Wellness, and it gives me great pleasure to take you through this session today. And we'll be specifically exploring the significance of corporate health assessments as a proactive approach to identify risks, promote prevention strategies, and empower individuals to take charge of their health, particularly concerning diabetes. If it's the first time you've joined one of our free sessions today, welcome. And it will give me a great opportunity just to walk you through what you can expect from one of these free taster sessions. So before we begin, let me just take you through what you can expect from one of today's sessions. So this is a free 30-minute taster, and it will give you a high-level overview of what you can expect from some of the education and training sessions here at PAN Wellness. So today's session will be recorded and it will be available on our YouTube page after the session. So if you wish to turn your cameras off and microphones, they should already be disabled nonetheless, but just bear that in mind that the session will be recorded. And if after today's session you'd like to find more about the education, training, or the health assessments that we offer, you can get in contact with us on the email address that you see on your screens there, which is businesssupport@panwellbeing.co.uk. So without further ado, we've got quite a lot to pack into a 30-minute session today. So what we're going to be exploring are these 5 key elements that you can see on the screen there. We'll kick off first and foremost and actually just explore, well, what is diabetes? What do we mean by that term? And the impact that it has specifically on individuals and in the workplace. We'll do a little bit of a deep dive into the role of nutrition, exercise, and lifestyle changes when it comes to diabetes prevention. So it'll be a light touch on some of the elements here that's particularly focusing on that lifestyle prescription. We'll explore the benefits of corporate health assessments when it comes to that early detection and prevention of diabetes. And particularly here, we're looking at type 2 diabetes. And then we'll just conclude the session by looking at some practical strategies and resources for diabetes prevention, particularly in the workplace. So for those of you that might be in line management, wellbeing lead or HR roles, this section will be particularly important for you, as well as looking at some insights into creating a supportive environment, particularly for employees who are diagnosed and managing diabetes. So firstly, let's consider that definition of diabetes, just so that we all know what we're talking about today. So the World Health Organization defines diabetes as a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. And insulin is a hormone that regulates blood glucose. And you'll most commonly know of two kind of main types of diabetes, not to say that this isn't kind of all exclusive, but type 1, where the body's immune system attacks and destroys those insulin producing cells, and type 2, where the body doesn't produce enough insulin or the cells don't respond to insulin properly. And particularly in 2022 to 2023, so some of the most recent data that we have from the World Health Organization, more than 5.6 million people in the UK were living with diabetes, which is actually a record high. And this actually includes 4.4 million people who have a diagnosis, and then the remaining 1.2 million who are likely living with type 2 diabetes but are not yet aware. So particularly the majority of people with diabetes in the UK have type 2 diabetes, with the number of people diagnosed with this type of diabetes almost doubling in the last 15 years. So particularly when we explore that impact of diabetes on a person's ability to work, so when we're really looking at, the impact that it has in the workplace, the first element to consider is that loss of productivity. So people with diabetes may experience a loss in productivity due to the demands of the condition. For example, people with type 1 diabetes reported a 23% loss in productivity, while people with type 2 who take insulin reported a 19% loss. I'm just going to pause at that point because I can see there's a few people in the chat that are having difficulty seeing the presentation. My suggestion would be if you can just leave the meeting and rejoin, you should then be able to see that on your screen. By all means, if that's not, if that doesn't work for you, like I said, today's session is being recorded, so it will be available on that YouTube channel afterwards. So thank you for letting me just interject there. But the second thing to look at is sickness absence. So people with diabetes may have more sick days than people without diabetes, and this will be for potentially routine GP appointments or more so looking at the complications that may arise with diabetes. Fatigue, in particular, can be a symptom of diabetes and may lead to a drop in performance. The stress as well of managing diabetes can impact mental health, which can make work pressures worse. And then the last point, actually quite an interesting one for those of you that are going to be in any health and safety roles. This word hypoglycemia, so a hypo or hypoglycemia, occurs when blood sugar levels drop too low. And hypos can cause symptoms like blurred vision, shaking, and loss of consciousness. So a severe hypo can be a health and safety risk, especially if that person is operating machinery or driving. So definitely worth considering if you're in an industry that does require that. So I'm going to just move on to have a look at lifestyle and prevention. Now, as I mentioned, this is only a short session today, so forgive me if this is only a light touch. But there are kind of 6 key factors here that we can look at in that prevention of diabetes, and particularly type 2 diabetes. And those key aspects include, firstly, nutrition. So reducing processed sugars and refined carbohydrates. So particularly diets that are high in refined carbohydrates and sugars, such as sugary drinks, pastries, and white bread, can increase insulin resistance. So it's important to look at choosing whole grains, fruits, and vegetables to help manage blood sugar levels. But also incorporating fiber-rich foods as well can actually help to slow down the absorption of sugar and reduce the risk of blood sugar spikes. So particularly foods that are high in fiber may include things like whole grains, legumes, fruits, and vegetables again. We can also consider healthy fats, so particularly healthy fats, including unsaturated fats from sources like olive oil, nuts, seeds, and avocados, can improve insulin sensitivity. We can also consider portion control, so maintaining proper portion size can help manage that caloric intake, which is essentially maintaining a healthy weight, and that is a key factor in diabetes prevention. And lastly, when we're looking at nutrition, think about reducing saturated and trans fats. So these fats that are found in fried foods, processed snacks, and fatty meats can lead to insulin resistance and increase the risk of type 2 diabetes. The second component to look at is exercise and physical activity. So, particularly, this can improve insulin sensitivity because regular exercise and physical activity increases the body's ability to use insulin effectively. So, both aerobic exercise, so anything that's going to make you a little bit out of breath and sweaty, maybe walking, running, swimming, and also strength training, such as weightlifting or even yoga, actually, can enhance glucose uptake by the muscles and lowering blood sugar levels. We obviously mentioned that weight management is an area as well when it comes to kind of prevention. So exercise can help with weight management, particularly obesity and especially abdominal fat is one of the major risk factors for diabetes. So being physically active can help burn calories, manage body fat, and help to improve that overall metabolic health. And the last elements to consider when we're looking at exercise and physical activity is that it can reduce inflammation. So, physical activity will lower systemic inflammation, which is linked to insulin resistance. And it will also help to keep the metabolism active, so improving the body's ability to process glucose and prevent that insulin resistance that I talked about lightly when we're looking at type 2. And we can also consider the four remaining lifestyle changes that you can see there on the screen. So, particularly making sure that we are getting adequate sleep. So, particularly chronic sleep deprivation and poor quality sleep can lead to insulin resistance, weight gain, and increased appetite, all of which contribute to a higher risk. So, prioritizing good sleep hygiene is key. We also need to consider reducing stress. So, chronic stress triggers the release of hormones like cortisol, which can elevate blood sugar levels and promote insulin resistance. So, some kind of suggested stress management techniques might be along the lines of mindfulness, yoga, or even meditation can help. We can also explore avoiding alcohol and smoking. So, smoking increases inflammation and oxidative stress, which can worsen that insulin resistance. And excessive alcohol consumption can also disrupt blood sugar control. So, quitting smoking and then limiting alcohol intake really can help to reduce that type 2 diabetes risk. And then lastly, we can explore regular health checkups. So, actually, this is something I'm going to explore a little bit more in a moment, but monitoring blood glucose levels and being aware of family history will also allow for early detection and proactive management of diabetes or other risk factors. So let's have a look at what we mean by kind of, regular monitoring, health screening, health assessments, all kind of the same kind of phrasing, really. We're able to assess diabetes risk as well as other risk through health assessments and regular screening. So it's worth just actually exploring, well, what is a health assessment? So, first and foremost, a health assessment is separate to occupational health. A health assessment is designed to be a completely free, confidential, and a voluntary health check, and it's there to actually give somebody an opportunity to measure some vital numbers relating to their health, such as blood pressure, blood glucose, and cholesterol. It enables the individual to access that early support and intervention when they might need it, so we can do something about it sooner rather than later. And it also gives you that one-to-one time with a physiologist or a health and wellness expert to actually inform you of any potential issues, whether that is relating to diabetes or something else, and then reinforce the good behaviours to actually support you with your health and well-being. And specifically, when we're looking at a health assessment for diabetes risk, we measure something called HbA1c. So that term refers to glycated hemoglobin, and it develops over time when hemoglobin, a protein that's within your red blood cells and carries oxygen throughout your body, joins with glucose in the blood, and then that cell becomes what we would refer to as glycated. So by measuring HbA1c, it gives our clinicians an overall picture of what your blood sugar levels look like within typically a period of kind of 2 to 3 months. So it's a good marker to actually assess kind of overall risk and longitudinal risk. And some of the benefits of incorporating that health assessment or that health screening, it plays a real vital role in reducing not only things like diabetes risk, but cardiovascular and cancer risk as well, by actually identifying risk factors sooner rather than later, but also educating individuals on prevention strategies and providing some of those tailored recommendations for healthier lifestyles. So it allows us to promote, those healthy lifestyle changes. So whether it's counselling, for example, on diet, exercise, or even sleep, as I touched on earlier, we can actually look at targeted education. So actually giving people the knowledge that they need to understand what increases blood sugar and how to maintain healthy glucose levels. It allows an opportunity to actually monitor kind of our blood sugar levels, so our HbA1c levels over time. So much like we would track changes in key metrics such as our weight, it allows us to do the same with blood glucose. So regular monitoring can motivate individuals just to stay on track with those lifestyle adjustments. It enables us to look at reducing the risk of complications that might be related to diabetes, such as heart disease, kidney disease, and vision problems. So when I talked about, individuals may be needing more time off sick, it could well be due to some of those complications. And lastly, we can look at improvements in workplace productivity and reduced healthcare costs. So things like claims on PMI. So particularly in workplace settings, health assessments can reduce absenteeism and presenteeism by keeping employees healthier and then lowering the risk of those chronic conditions. So I mentioned at the start of today's session that some of these elements are going to be geared towards those of you that are potentially in line management roles or working in HR. So I wanted just to touch on some strategies for diabetes prevention at work. So there are some, I guess, three key practical strategies and resources for diabetes prevention in the workplace. So particularly organisations may wish to consider health assessments, as we've just talked about. It might be to encourage some healthy habits, maybe by looking at the environment and the workplace setup, whether that's whether individuals have got access to healthy foods, have you got any physical activity in place? So I know some organisations very much look at doing things like a wellbeing Wednesday, so it might be walking groups that go out on a Wednesday for those of you that might be working hybrid or in offices. And education as well. Educating employees is going to be absolutely key. And that's not just education on diabetes risk, but the elements that go with it as well, like we talked about earlier. So, whether that's nutrition, exercise, sleep, and stress, for example. It's really about giving people those tools to empower them to make some positive changes and some positive lifestyle amendments. And for employees and again, health and safety professionals, there are many toolkits and resources that are available online to help support you with people that have diabetes. We'll come on to that a little bit more in a second about how you can manage diabetes at work. But there are some really nice tools from both Diabetes UK, Safety First Aid, and also ACAS that I would strongly encourage you to have a little look at. So the final part that I would like to go through, which will just kind of bring us to a close of today's session. And like I said, today is a free taste session, so lots to pack into just to give you a bit of a taste and a bit of a flavour when it comes to that diabetes defence. But we're going to just have a look on this final slide now at how to create a supportive environment for employees when it comes to managing diabetes. And it really does involve a combination of workplace accommodations, education, and also policies that will prioritise both health but also inclusivity as well. And that's certainly something that is on everybody's agenda, and rightly so. So I just want to run you through kind of 8 key areas that can help you foster that positive environment. So first and foremost, we can have a look at raising awareness and educating the workforce. So these might be educational sessions to increase awareness about diabetes in particular, so particularly helping to reduce stigma and promoting the understanding of the condition, but also workplace training to teach employees about the symptoms as well of low and high blood sugar. So, particularly if you are in a safety critical role or you've got employees that are in safety critical roles, that can actually be really powerful training. So, you understand what you can do to look out for individuals who might be having that hypoglycemic attack, as we mentioned at the start, but actually how colleagues can support in case there is an emergency. As a workforce, you can also look at promoting healthy eating options. So, making sure that there are healthy food options available in both your cafeteria and vending machines. So, really considering the environment that you're working in. And this will include items that are low in sugar and low in carbohydrate. But also allowing individuals to take breaks as well for meals and snacks. So, particularly those that are experiencing and living with diabetes, it's important that they do maintain those stable blood sugar levels. You might also want to consider flexible working arrangements as well for those that are managing their diabetes at work. So particularly employees with diabetes may need a little bit more flexibility with break times to manage blood sugar through meals or medication, but also allowing for remote working when it's needed, especially if that diabetes management or medical appointments will require that extra time or focus. You might want to think about the environment in terms of, is it a diabetes friendly kind of physical environment? So, do your employees have access to private or clean spaces where they might need to check their blood sugar levels or administer insulin? And that might be, first aid rooms or even welfare rooms on site if you have that luxury, but also comfortable workspaces as well, particularly if employees need to kind of manage their fatigue. The fifth area for us to have a look at is ensuring that there's access to that medical support. That might be health insurance coverage, so particularly health insurance that covers diabetes management, tools, medication, and those regular health checkups that we mentioned earlier. And making sure that you obviously do have those kind of first aiders on site that are trained in that diabetes care and know some of those signs and symptoms to look out for. We mentioned earlier that physical activity is one of the key elements for diabetes prevention. So you might want to consider how you can actually encourage movement. So whether that's promoting physical activity through some simple activities, such as walking meetings, so walking and talking meetings, even standing desks, or even on-site facilities if you do have those for fitness, so such as on-site gyms. But you can also look at creating programs that are encouraging physical activity, such as yoga or fitness challenges, which will benefit not only employees with diabetes, but actually the whole of your workforce. So you have got that inclusive benefit. Do also consider that mental health support as well. So, particularly a chronic illness like diabetes and others can be stressful. So, offering programs that will help employees manage stress, and that might be a program such as an EAP, so an employee assistance program, for example. And just making sure that line managers, but also health HR professionals know where to signpost those employees and how they can access that support. And lastly, have a look at your policies as well. So just making sure that workplaces do have somewhere within their policies, it could be a health and safety policy, an outline of how they can support people with diabetes. And particularly with that, you might want to consider how you can look at making those reasonable adjustments. So to conclude today's session, obviously a lot to pack into today, but hopefully it's given you a little bit of a high level overview of diabetes prevention, but also some of the ways in which we can support your individuals as well. But I just want to leave you with this final slide of how you might want to consider supporting your workforce in that prevention of diabetes. We mentioned about health assessments that might include some short assessments, so 15-20 minute assessments such as health MOTs, or some longer length assessments, such as some on-site executive health assessments, which will cover not only your basic measures like that HbA1c we mentioned earlier, but some more comprehensive testing as well. And throughout today's session, we also mentioned that education will be a key factor. So you might want to consider some training around diet, healthy aging, and even resilience. You'll have to forgive me, my voice is now going at the end of today's session, but I will just leave you with the final slide here. If you are interested, obviously, or have any questions following today's session, please do direct them into business support at pamwellbeing.co.uk. I can see there's been a few questions in today's chat. I'm not going to have an opportunity to have a look at those for you today, so please do send them through to business support at pamwellbeing.co.uk. And of course, if you're interested in any of the services we've discussed today, you can get in contact with us there as well. So thank you so much for joining today's free taster session. Wish you a really great Thursday, and we'll see you on the next one. Thank you.